Hello everyone, this is Dr. Lediju here. This month is Men's Health Month, and we would like to discuss about social determinants of health and how it affects healthcare in our patients, most especially in men, but also women, children, and pretty much all our patients. By definition, social determinants of health are pretty much non-medical factors that influence health outcomes in our patients. They include socioeconomic factors such as education, job status, community resources, access to healthcare in our patients, physical environment, community safety, and also healthcare behaviors in our patients, so things around diet, alcohol use, tobacco use, regular exercise. So all of these contribute to social determinants of health, and for us as healthcare providers, it's important for us to address social determinants of health because it accounts for about 80% of health outcomes in our patients. And it's also very important to address it because it improves and it's important for overall health in our patients as well. So by definition itself, health is a state of complete physical, mental, and social well-being, and not just the absence of disease. For us as healthcare providers, we tend to focus a lot on the disease aspect, on the clinical aspect, but there is a physical part, there's a mental part, and there's also a social well-being part, and it's important for us to work towards addressing that because that helps improve healthcare outcomes in our patients. By definition, health equity is a principle which supports fair distribution of resources so that patients and groups with social disadvantages have the freedom and opportunity to attain their full health potential. And when we talk about full health potential, we're talking a lot more about the physical and social well-being as well. So addressing social determinants of health help us improve healthcare equity and also reduce healthcare disparities in our patients and overall improve health outcomes for our patients. For Men's Health Month, we have a couple examples of patients that we've been able to see in clinic, and we were able to address social determinants of health for them, and that went a very long way in improving their healthcare. For the first patient, we just call him KD, those are his initials. 54-year-old male, has a past medical history of type 2 diabetes, high blood pressure, hyperlipidemia, sleep apnea. He's on a CPAP, which he has not been using for a long time just because he lost his job and he could not afford healthcare. So he came into clinic, not used his medications for over a year. So when he came to see us in clinic, we did a lab for him in clinic. His A1C came up at about 9.6. Also, his blood pressure was in the 160s, and that's mostly because he's not been taking his blood pressure medications at all. With his poorly controlled diabetes, he was beginning to have symptoms, excessive urination, he was waking up a lot at night to pee, and also he was having neuropathic pain from that as well. Also, he had not been taking his cholesterol medication, so we did a lipid lab for him, and his ASCVD risk, which predicts the risk of a heart attack for him, was at about 48%. So he was in a pretty bad shape when he came in, and that's mostly because he had lost his job, he couldn't afford his insurance, and he couldn't afford his medications. Also, he had a psych history of depression, PTSD, and he had not been on his psych meds over a while. He had a divorce recently, and that just kind of tipped him over to be more depressed and more anxious. So we were able to refer him to the community health worker, thankfully, Cheryl, and she was able to get him some resources in the community. She was able to set him up with Badger Care and also the Wisconsin Medical Assistance Program. And that went a long way for him to be able to afford his medications, and also through that he was able to get referrals to the endocrinologist, to the psychiatrist, And all that was able to set him on the right path. His blood pressure improved, his blood sugars also improved, and he's been compliant with his medications ever since. So that's just one case of a patient who had come in with no health insurance, with pretty much a lot of social determinants of health affecting his health care, and we're able to address that through screening and also getting the appropriate referrals for him to get help. We have a second patient, we'll just call him BB, 55-year-old male, history of varicose veins in his legs. He had really swollen legs, he had pedal edema, he had depression, mood disorder, also had cognitive impairment following a motor vehicle accident where he had a traumatic brain injury. Also had history of alcohol use disorder and folate deficiency, vitamin deficiency, and that's largely because he was not eating right, he was not eating well. So he had come into clinic for his first visit. We started him on water pills for his swollen feet, started him on compression stockings, and sent him home. Came back for follow-up visit, and his legs were actually more swollen than it was previously, and that was concerning. So he was screened for social determinants of health, and we were able to get a lot of information for him. Due to the fact that he had cognitive impairment, he had lost his job, so he could not afford good food, he could not afford good transportation down for his clinic appointments, and also he had to be brought in by his parents, and that was concerning. So we did the screening. Also, we were able to get him referral to the community health worker, Cheryl, and she was able to work with him to get assistance. So he was able to get food share assistance, also some mortgage assistance, and he was referred to St. Croix County Job Center for employment assistance, and all that set him on the right path. Also was able to get Medicaid transportation assistance for his clinic appointment, so he was able to be compliant and show up for his clinic appointments. I was also able to establish care with psychiatry. He was started on psych meds. He was making a lot of improvements with his mood disorder. He was eating right. He was also able to cut down on his alcohol use, and he was scheduled with occupational therapy for cognitive testing and also cognitive therapy, and he made lots of improvement over time. So that's also another case of a patient who had come in a pretty bad state, and we were able to get him all the necessary help that he needed to be able to get the best health outcome. So all these cases show that addressing social determinants of health goes a very long way in improving healthcare in our patients, and not just focusing on the clinical aspect of the healthcare, which we tend to do as healthcare providers. It's important for us to address social determinants of health, especially for vulnerable patients at risk of healthcare disparities, and that is affecting their health outcomes negatively. So for us as healthcare providers, we will advise that we should continue regular screening of patients, especially when they come in during annual physicals, also patients with history of psych disorders, patients with history of unemployment, patients without insurance. All that goes a very long way in providing them community resources to help improve their health outcomes. For us at Western Wisconsin Health, we've been able to develop a community resource questionnaire, which has been a very valuable tool for us to help screen patients for social determinants of health, and also help us gain valuable data about our patients. And through this data, we've been able to give patients the necessary resources, the necessary help, and we'll also encourage other healthcare providers to make use of this tool to improve health outcomes in our patients. Thank you.